Today, the surprising link between chronic cannabis use and lower obesity risk, and what the adipoinsular axis has to do with it. A counterintuitive finding keeps appearing in large population studies. People who use cannabis regularly tend to have lower body weight and reduced rates of type 2 diabetes compared to non-users. This is paradoxical because acute cannabis consumption is known to stimulate appetite. So what's driving the long-term metabolic benefit? To understand this, we need to look at the adipoinsular axis, a bidirectional communication network between adipose tissue and the pancreas. Adipocytes release hormones called adipokines, including adiponectin and leptin, which directly influence pancreatic beta cell function and insulin sensitivity. When this axis works well, glucose homeostasis is maintained. When it breaks down, insulin resistance and metabolic syndrome follow. In obesity, the adipoinsular axis becomes dysregulated. Adiponectin, which normally enhances insulin sensitivity and protects against inflammation, becomes suppressed. Research shows that obesity causes DNA hypermethylation of the adiponectin gene promoter, effectively silencing it. This is one mechanism by which diet-induced obesity disrupts glucose homeostasis and drives type 2 diabetes progression. A 2026 study published in the Journal of Physiology used a diet-induced obesity mouse model to test whether chronic cannabis exposure could restore adipoinsular axis function. Male mice were fed a high-fat, high-sucrose diet for 60 days to induce obesity. At day 30, mice began receiving daily doses of either THC at 5 milligrams per kilogram or cannabis extracts matched for THC content for the remaining 30 days. Both THC and cannabis extract reduced body weight and fat mass in the obese mice. This aligns with prior research showing chronic THC can prevent diet-induced obesity, partly through gut microbiota modulation. So THC alone does produce measurable metabolic effects in this model. But the critical finding came from glucose tolerance testing. Cannabis extracts, but not THC alone, normalized glucose clearance in the obese mice to levels matching lean control animals. Extracts also normalized adipokin expression more effectively than THC. THC improved weight and fat mass, but only the full extract restored normal glucose homeostasis. The researchers also tested both compounds on 3T3L1 adipocytes in cell culture. THC and extracts both produced anti-adipogenic effects and altered cellular bioenergetics in a concentration-dependent manner. This confirms the effects are reproducible at the cellular level and not solely dependent on whole organism metabolism. The proposed mechanism involves restoration of impaired adipoinsular axis function via endocannabinoid system modulation. The endocannabinoid system, which includes CB1 and CB2 receptors, is known to be overactive in obesity, contributing to insulin resistance and metabolic dysfunction. Both THC and full extracts appear to normalize this overactivity, but the full cannabis matrix in extracts produces effects that isolated THC cannot replicate. For psychiatric practice, this research has several implications. Many antipsychotics cause significant weight gain and metabolic syndrome, and the endocannabinoid system may be a therapeutic target to counteract this. Unlike CB1 antagonists like rimonabant, which showed metabolic benefits but caused depression and suicidality, CB2 selective agonists may offer metabolic benefits without psychiatric risks. The non-psychoactive cannabinoid, THCV, which acts as a CB1 antagonist, has already shown promise in a human trial for type 2 diabetes, improving fasting glucose and beta cell function. Important caveats apply here. This is a mouse study. Human confirmation is needed before any clinical conclusions can be drawn. Cannabis contains dozens of active compounds beyond THC, and the extract used in this study likely contains multiple cannabinoids and terpenes that may work synergistically. The research gap on full extracts versus isolates in humans remains significant. And while epidemiological data consistently shows the obesity paradox in cannabis users, observational studies cannot establish causation. This is promising preclinical science that warrants further investigation, not a recommendation for cannabis use as a weight management strategy. Questions or episode ideas? Drop them below and subscribe for more psychopharmacology breakdowns. Educational purposes only, not a substitute for clinical judgment.